Every year, about 3,278 children and adolescents develop cancer in Uganda, yet only 36% are able to access care at the Uganda Cancer Institute or regional centers. This means that 7 out of 10 children never reach treatment centers. Experts say early detection and strict adherence to treatment can save lives. One such survivor is Moses Echodu, who this year marked 25 years cancer-free.
In June of this year, I celebrated 25 years of being cancer-free. Personally, I had Burkitt's lymphoma as a child, and it was a nightmare in terms of treatment. Some days you want to eat food, some days you don't want to eat food. Some days you want to hear people talking, some days you would rather they just go home and leave you alone. Some days you want to die, and that's the reality of the disease. We've looked at our data, 5-year survival data, and we've actually demonstrated that 68% of our children with Hodgkin's disease, and that's a type of lymphoma, and lymphoma is a cancer from the lymph nodes. 68% of children with this kind of cancer survive their disease. When it comes to Burkitt lymphoma, it's another type of lymphoma that you see very commonly that causes the jaw to swell. Almost 50% of these children are alive and cured of their disease 5 years after the diagnosis.
But there are different reasons as to why people delay or don't seek treatment, or why 7 out of 10 children do not make it to the cancer centers for treatment. These include stigma, poverty, long distances to cancer centers, and belief that children do not get cancer.
Now we have a regional cancer center in Mbarara with a dedicated section for managing cancer in children. Then you have also now Gulu Regional Cancer Center that's still being developed. But overall, to get a comprehensive care, somebody needs to come to Uganda Cancer Institute. So that distance issue also affects. And then poverty, many people are coming, many people in a rural upcountry area, the level of income still may not facilitate them well to seek care in the urban center of Kampala.
Experts say parents should take children to hospital when they present with persistent fever, unexplained swelling, unexplained weight loss, among others.
Abnormal swelling you see on the child, which is not explained. This child didn't fall maybe yesterday or last week and then got some swelling somewhere here. But this child feels unwell. You go to nearby facilities, they do some treatment clinically, they no response. That persistent swelling suspect cancer in the child. One of the commonest childhood symptoms that signal possibility of cancer in children is persistent fever. Put a question mark on that persistent fever. Take this child to the higher level hospital.
But even for survivors, the battle does not end at cure. Many children face long-term challenges, including catching up with school and reintegrating socially after years of treatment.
For some of these children, they have lost time on school, and so they have seen their friends progress, while for them they remain behind. That has an impact in how a child develops.
So working with Ministry of Education, we must ensure that we have an exam center, for example, at Uganda Cancer Institute. Why should a child not do their PLE? Why should they not do their O-level or A-level exams just because they are getting treatment for cancer?
Globally, the World Health Organization estimates that about 400,000 children and adolescents are diagnosed with cancer each year, with the most common types being leukemia and lymphomas. Nobert Atukunda, NTV News.